So two sort of contrasting but interestingly complementary perspectives on aspects of the economics of countering microbial threats. Dean talking about how we think about the balance between country-specific investments and international collective action. Tanya sort of casting a lighter focus on a bit of the response that is often neglected, but also the sheer practical implications of having all these multiple interventions sort of tripping over each other and what it means for the person actually delivering care at the front line. I'd like to open it up to discussion. So if people want to raise, anybody wants to ask a question or make a comment, shall I start with you, Kimberly?
Yeah, sure. First, very provocative presentations. First of all, I think that one of the biggest challenges is that in the globe, we have huge disparities in terms of the quality of the systems that are out there. And I think one of the things that we've learned in the context of eradication programs is that what we really need is accountability for performance. So when we look at a country like Nigeria, we spend significantly more to vaccinate a child in Nigeria. And part of that is that even though we're allocating that money to the system, it's not making its way down. There's no accountability within the system, and the government doesn't necessarily feel responsible for that. So when we talk about country ownership, I think part of what people who I talk to are worried about is making sure the country owns the responsibility for the accountability for performance, which it's not happening, universally right now. So in this space, to me, that is a fundamental issue. I do think the new WHO Director General is thinking a lot about this in the context of Africa, especially with the polio money going away. And, I think with respect to the fungibility of the resources, we have a real challenge here because, well, it sounds really good to do health system strengthening. That's like motherhood and apple pie, right? What it really translates into in terms of actual performance of those systems is very unclear. And if we don't actually have the ability to track where those resources are going and what they're doing, I think we have a real issue here because we have historical examples of giving money to systems where it's gone to places it wasn't supposed to go or where it didn't lead to any actual improvement. And I think in the context of trying to think about how do we improve the situation, part of what we need is a lot more transparency in what's going on in all these systems. Why does it cost so much more? Why do people like Amina not get the money that they're supposed to get? Who is paying for her to be there? So right now, the HIV and TB program may be, in fact, the biggest source of her salary because they're the reliable ones and they're the ones who are holding her accountable for what she's doing. I don't know. Responding to the example. But I will say that in the context of emerging threats, if we want capacity out there, we do need to have some sense of awareness about what we have that's out there, who's responsible for it, what it can and can't deliver, et cetera. And I think this trying to figure out how much it all costs and then trying to get governments to be responsible at a level that they can be paying in is a critical issue. And I think coming back to, Dean, your comments, one of the challenges with aid is exactly this issue of if we give them this much money for one particular thing, they shift those resources that they would have spent themselves on that to something else, which may not even be in the health sector, which was also the comment from Larry Summers. So I think the biggest challenge here is to try and figure out how we deal with accountability and making sure that people feel like their money is being wisely spent. And I'm not sure we have an answer here, but I'm
just conscious of time. I'm going to take another couple of questions, and can I ask people to be quite succinct? So,
Hi, Jonna Mazzette from University of California, Davis, but speaking sort of more from the perspective of international development from the USAID PREDICT project. And thank you both for great presentations. I think moving to something for Dean, I'm super interested in the relative benefits of the two strategies that you put forward. I wonder if there isn't a hybrid and where you see a hybrid falling in that we are funded by USAID for a global program, more on the R&D side, but its aims are for pandemic preparedness, more on the national side. So to accomplish that, we work in 30 countries with in-country teams to both build their capacity as well as involve them in the global, international, whatever collective for that international aim. So it's sort of straddling both sides of your boxes, and I wonder what the relative advantages and disadvantages of that are.
Okay, I'll take one more, and then Katarina.
Just an observation, really. Tanya, I was very impressed by the large-scale study you did of the healthcare facilities in Nigeria. Really,
Can you put your mic on?
I have it on. Okay, closer here. So I was impressed by this large-scale study you did, and just an observation from mine. It's really an issue, I think, of how can we evaluate the cost-effectiveness of health system strengthening, which means we have to evaluate the costs and the benefits of all interventions that rely on the health facility or the platform that we are strengthening. Because really it's an issue of economies of scope, whereby the delivery of the joint delivery of intervention the benefits and costs is different than if they were delivered separately. And I think there are quite big methodological challenges of doing this. So I think there is a call for really improving our methods here. Thank you.
I only see one other question. I see two more. So why don't we quickly answer these three, and then we'll come back. So pick and choose which bits you like.
On the question of hybrid, country-specific plus serving global goods, global needs, I think that the actual location of spending of advancing international collective action can be either in a high-income country or in an international agency or in a low or middle-income country. And the example you described around pandemic preparedness seems to be exactly an example of money being spent on international goods, but much of that money being spent within countries. And from a political purpose, I think that's a sweet spot. Question from Kimberly, or observation, one of the observations was around health system strengthening, and Katarina as well. It is, as you said, or at least my perception agrees with yours, very much a stated favorite of donors. But if you look at actual patterns of donor spending, more and more is spent on health systems, but mostly it remains on rather focused programs. I personally think that's a good thing. Reallocating toward health systems is inviting a loss of accountability, a loss of capacity for donors to go back to their parliaments and say, we got this done. You go back to the parliament and say, we helped strengthen a health system. No, we avoided 346 TB deaths. That's easy to communicate. So for accountability reasons, to avoid having the money just be spent on something else, the fungibility problem, I think that having within country efforts tightly focused on real health objectives, mortality reduction objectives, and particularly ones that are not likely to be locally funded, like pandemic preparedness.
Thank you. To the question around the cost effectiveness, I fully agree. I think one of the challenges we have on the cost effectiveness is that we sometimes keep it at very global levels. And so what I think as a community we could be much better is actually sitting with the governments with these cost effectiveness analysis and bringing the facts to the table, almost sort of the three graphs or the three bars I was showing on the page previously, and saying, this is what you're paying for your system today. This is the level of performance you get out of it. If you were to invest more, this is what you would actually be investing in. These are the benefits. I'm not sure that we are effectively having those conversations and empowering people within the system to understand the trade-offs. Often I think we have a bit of a tendency as a community to set some very good, high aspiration, best practices, but we actually go and cost out those things. There's no way that some of these healthcare systems could afford those solutions. So how do we actually give them different options and lay out the trade-off? On the accountability challenge, I I couldn't agree more. I think it is one of the biggest challenges also in the countries that I've been working in. I do want to potentially pose a bit of a counter argument to what Dean was saying, in that I certainly think that there are certain countries where the system can be so fragile and weak that it's very difficult to engage into health system conversations, but also think that there are a number of countries that through economic development are aspiring for more for their countries, and also starting to think beyond the traditional donor-funded diseases and looking into non-curable diseases. And in those particular governments, there is an interest for having these health system conversations more. I think it is difficult, but it does require us to engage with these countries around the health system conversations more broadly, and try to hold them accountable if they're ready to move forward from sort of a very vertical approach into a more of a system approach. And I think there are countries, as they develop and so forth, that are ready for those conversations, and I think we should be open for those as a community.
I'm conscious of time, but we did start a bit late, so I'm going to ask the two people who have cards up just very swiftly. So Mukesh first, and then we'll give succinct answers to succinct questions.
Thank you. A very succinct question for Dean. Just as we know that the economics of public goods is different from the economics of private goods, as in the economic sense, and the economics of public goods in the non-economic sense, more so the common goods, is different from those of the specific goods. The same way, the politics behind this is also different. And countries, when they make decisions about where to put in the money, are trying to balance the politics and the economics. I'm just curious as to what you think about how can we help both the countries and the donors and ourselves in understanding these two very different forces and finding a bridge across them. Because I keep on thinking all the time, we have $75 billion under IDA at the World Bank at concessional loan, practically at a negative interest rate. Imagine how much of that goes to health. Thank you.
Sorry, and one last question.
Just following, I'm Mark Miller from University of California, Berkeley. Following up on Kimberly's questions about governance and infrastructure systems in a challenging tropical environment, how perhaps you can comment about the role, for example, of Northern European donors who look at systems, and Chinese entrepreneurship, which has taken off in much parts of Africa. How does that fit, or how could that be used vis-a-vis supporting these vertical type of programs, which, again, accountability and efficiency and incentives on the short term really don't allow for long-term productivity?
Do you want to start by dealing with Mukesh's question?
Sure. I think one major objective of aid is, I think, informational, bringing international experiences to local circumstances. And there we have to ask what is the comparative advantage of the international system, and around two separate questions. One, you posed the question of politics versus economics. Clearly, both are important. But I think the international system often has very little to say about domestic politics and a great deal to say about economics. So I think we on the outside should probably focus on the economics. And a similar story on the health systems. Health systems are unquestionably important, but they're domestic issues. What do we know in general? I mean, you read the health systems literature. It's not like it's a literature that is really got a lot of strong messages. We on the outside know how to deal with tuberculosis and malaria and AIDS and probably supply chains as well. So there's a specific set of technocratic issues where the international community has clear capacity to bring value. And there are others where I think we have essentially no capacity. Let's focus on where we can bring value.
Yeah, just a quick maybe reflections on what Mark was saying in terms of the Chinese entrepreneurship, etc. I do think from an in-country perspective, it's interesting with the Chinese coming in to the countries. And so if you think about the various CDCs across the continent, you're certainly seeing them playing a much bigger role. Now, a lot of that focus till now is on the infrastructure, and it's clear there are massive infrastructural gap around some of the CDCs. It does raise a question as to what about the systems, what about the processes, what about the humans that are supposed to operate these different systems, and to what extent they will get involved in those pieces as well. But I do think many of the African governments are interested in opening for those conversations, and I think that's a good dynamic, quite frankly, in the coming years to be seen how it plays out.
Thank you. Well, we've run out of time. That was a very substantive way to get the morning started. And certainly from my perspective at the Global Fund, these are all issues that are frankly practical. We wrestle with the vertical versus health system. As you can see from Tanya's slides, we're part of the problem on the supply chain issues, and also the balance between what we do on a transnational basis. We're increasingly doing regional programs, and what we do at a country level is again a very practical set of questions that I am finding I face in my new role. So if I could ask you all just to join me in thanking Dean and Tanya. Thank you very much.